In my clinical practice, there is one medical event that terrifies my older patients more than almost anything else. It is not cancer. It is a stroke. I have sat across from patients who are 65, 75, and 85 years old. They tell me, "Doc, I can handle getting older, but please, don't let me have a stroke. I don't want to lose my ability to speak, to walk, or to feed myself. I don't want my spouse or my children to become my full-time caretakers." If you are over the age of 60, maintaining your independence is everything, and a stroke is the ultimate thief of independence. It strikes like lightning, often with zero warning, and in a matter of minutes, it can alter the entire trajectory of your life. But what if I told you that a stroke is rarely just bad luck? What if I told you the foundation for a stroke or a major heart attack is laid decades in advance, driven by a silent mechanism that most people completely ignore until it is too late? Welcome back to Health and Wellbeing. Today, we are going to do a complete clinical masterclass on your vascular system. We're going to move past the standard advice of simply eat less salt and take your pills. Instead, I am going to show you exactly what is happening inside your arteries as you age. We are going to uncover the biological miracle molecule that keeps your blood vessels young, and I will give you a science-backed protocol to reverse stiff arteries, lower your blood pressure, and dramatically reduce your risk of a stroke. Take a deep breath, grab a notebook, and let's protect your independence. The endothelium and the microscopic sandpaper. To understand how to prevent a stroke, we have to look at the plumbing of your body. You have roughly 60,000 miles of blood vessels, but they're not just inert plastic pipes. The inside lining of every single artery, vein, and capillary in your body is coated with a single layer of cells called the endothelium. This layer is so incredibly thin that if you scraped off all the endothelial cells in your body, they would easily fit into a standard shot glass. Yet, this microscopic layer is the command center for your cardiovascular health. When you are young and healthy, your endothelium acts like Teflon. It is perfectly smooth. Blood cells glide right over it. More importantly, a healthy endothelium produces a miracle molecule called nitric oxide. Nitric oxide is a vasodilator. It signals a smooth muscle around your arteries to relax and open up, which keeps your blood pressure low and ensures perfect blood flow to your brain and heart. But as we pass the age of 50 and 60, something dangerous happens. We develop endothelial dysfunction. Think of your blood pressure. If your blood pressure is chronically high, say 140/90 or higher, that blood is rocketing through your arteries with immense force. Over time, that high pressure acts like microscopic sandpaper on that delicate Teflon lining. It creates tiny micro tears in the endothelium. Once that lining is torn, it loses its ability to produce nitric oxide. Your arteries can no longer relax. They become stiff, rigid pipes, and it gets worse. Your body tries to patch those micro tears using cholesterol. Over years and decades, this cholesterol hardens into plaque. This is atherosclerosis. If a piece of that plaque breaks off and travels to your brain, it blocks the blood flow. That is an ischemic stroke. The hidden culprits, it's not just salt. For decades, you've been told that salt is the enemy of your blood pressure. And while severe sodium sensitivity is a real issue for some people, salt is only a fraction of the story. If we want to heal the endothelium and prevent a stroke, we have to look at the 3 hidden culprits that are destroying your nitric oxide production right now. Number 1, chronically high blood sugar and insulin resistance. When you eat a diet high in refined carbohydrates, sugary drinks, and processed foods, your blood sugar constantly spikes. This causes a chemical reaction called glycation. Simply put, sugar molecules bind to proteins in your blood vessels, making them stiff and brittle. It is like caramelizing the inside of your arteries. If you are pre-diabetic or have type 2 diabetes, your risk for a stroke doubles precisely because of this vascular damage. Number 2, the dangerous myth of antibacterial mouthwash. This is a clinical reality that shocks most of my patients. You actually have a symbiotic relationship with specific bacteria that live on the back of your tongue. When you eat certain foods, these oral bacteria convert the nutrients into nitrate, which you swallow, and your stomach acid then converts into that life-saving nitric oxide. If you use harsh, alcohol-based antibacterial mouthwashes every morning and night, you are wiping out the microbiome in your mouth. Clinical studies have shown that using antibacterial mouthwash twice a day can significantly raise your blood pressure because you're completely shutting down your body's nitric oxide production pathway. Number 3, sleep apnea. If you snore heavily, or if you wake up gasping for air, you may have obstructive sleep apnea. Every time you stop breathing at night, your oxygen levels plummet and your brain panics. It dumps massive amounts of adrenaline and cortisol into your bloodstream, causing your blood pressure to violently spike hundreds of times a night. If you do not treat sleep apnea, you are essentially driving your cardiovascular system at 100 miles an hour while you sleep. The nitric oxide rescue. Now that we know the mechanics of the disease, how do we stop the ticking clock? How do we heal the endothelium and get our arteries producing nitric oxide again? Step 1 is the dietary nitrate protocol. We must flood the body with the raw materials it needs to produce nitric oxide. Nature has provided this perfectly in the form of dietary nitrates. The absolute best sources are dark, leafy greens, and certain root vegetables. I tell my patients to focus heavily on arugula. This is the undisputed king of dietary nitrates. It contains more nitrates per serving than almost any other vegetable. Beets and beet juice. Clinical trials have repeatedly shown that consuming beet juice can significantly lower systolic blood pressure within hours of consumption, purely through the massive release of nitric oxide. Spinach and Swiss chard. To protect your vascular health, you need to incorporate a large serving of these nitrate-rich foods into your diet every single day. And remember, chew your food thoroughly to allow those bacteria on your tongue to start the chemical conversion process. Furthermore, we need to protect the nitric oxide you do have from oxidative stress. This is where antioxidants come in. Pomegranates and berries are rich in polyphenol that prevent nitric oxide from degrading in your bloodstream, allow it to keep your arteries open and flexible for much longer. Capillary growth and Zone 2 cardio. Step 2 of our protocol is strategic movement, specifically Zone 2 cardio. When we talk about exercise for heart health, many people think they need to be gasping for breath on a treadmill. For older adults, that is not the goal. The goal is a process called angiogenesis, the creation of brand new blood vessels. When you engage in steady, moderate aerobic exercise, where your heart rate is elevated, you are breaking a light sweat, but you can still hold a conversation. You signal your body that it needs a better delivery system for oxygen. In response, your body literally grows thousands of new microscopic capillaries. It builds vascular detours. By increasing the sheer number of blood vessels in your body, you reduce the overall pressure in the system. It is like opening up 3 new lanes on a congested highway. The traffic suddenly flows smoothly and the pressure drops. Aim for 150 minutes a week of brisk walking, cycling, or swimming. Consistent, moderate movement is the strongest medicine we have to keep the endothelium young. Clinical summary and outro. A stroke does not have to be an inevitable part of aging. Your arteries are dynamic, living tissues that will heal if you give them the right environment. Stop treating high blood pressure as just a number on a chart. It is a sign of a struggling endothelium. Toss out the harsh mouthwash. Get a sleep study if you snore. Load your plate with arugula and beets, and get out for your daily brisk walk. You have the power to keep your arteries flexible, your brain healthy, and your independence intact. I have placed links to the medical studies detailing the nitric oxide and endothelial research down in the video description. Thank you for joining me today on Health and Wellbeing. If this masterclass gave you valuable tools to protect your future, please hit the like button and share this video with someone you love. Subscribe to the channel so we can continue to navigate the science of healthy aging together. Stay proactive, stay healthy, and I will see you in the next video.